Hi, I am Caitlin over here at TherapyWorks, and I'm joined today by Britani Baxter, who is one of our PTAs and a really great clinician on pelvic floor. So she's going to talk to us today about pelvic floor therapy. This might be a little bit of a longer one because, honestly, it's just a big topic that I don't know a lot about, and I'm sure a lot of you don't have a lot of information on or are here because you want to learn more. So, since it is such an odd kind of a, unusual area of therapy, let's just start out by Britani, what got you interested in pelvic floor therapy?
So the main thing that got me interested in the pelvic floor therapy in general is just being able to help so many more people. It's one of those things that women kind of are told growing up that, it's the things that you experience, especially postpartum, are normal and everybody goes through it and it's just part of life and everything, but realistically it's not. And there are ways that we have found that we can fix that and we can help them achieve whatever goals that they're having, whether it be more of an incontinence issue or pain within the pelvic floor. So just being able to help so many more people outside of the general orthopedic diagnosis.
Yeah, I mean, it is definitely an unusual one, but it does help so many people. I mean, sorry, I'm just kind of repeating what you're saying, but that really speaks to me because I definitely grew up, hearing from friends like, she just pees when she sneezes because she's had babies. And that's a normal thing that happens to everyone. It has to happen to everyone, but it doesn't have to be that way.
Right.
So you kind of mentioned this a little bit, but what kinds of conditions can you treat with pelvic floor therapy?
Yeah, so the main things we're going to treat with pelvic floor therapy is going to be either incontinence, and that can be like a stress incontinence. So that's where you hear people who, laughing, coughing, sneezing, jumping, cause them to leak a little, or somebody who has the urge to go to the bathroom. So it's somebody who feels like they have to go to the bathroom, and if they're not there in 20 seconds, they're worried that they're going to end up leaking. But also pain, which could be, for women especially, it could be, pain with using feminine hygiene products, or it could be pain during pelvic exams or pain during intercourse. And then we also do pre and postnatal pelvic floor physical therapy as well.
Yeah, as prenatal, that sounds like a time when you would really need your pelvic floor to be functioning well.
Yes.
Absolutely. It's doing a lot of work. So that makes a lot of sense. So I guess that kind of brings us to our next question of can you receive pelvic floor therapy while pregnant?
Yeah, for sure. Biggest thing is we just ask that you make sure you let your OB know that it's something you're looking into or something that you've heard about. If they aren't your referring doctor, just making sure that you're talking to them and making sure you have that okay from them to go ahead and move forward with the pelvic floor therapy. It's one of those things that it's a great way to strengthen the muscles of the pelvic floor prior to childbirth, but also learning the relaxation techniques for childbirth as well. And all of our staff here is really great at knowing that, most OBs recommend that once you're past a certain point in your pregnancy that you're not lying flat on your back, and knowing how to adapt to situations like that so that we can still give the patient the best care that they deserve.
Right. Absolutely. And, and we'll talk a little bit later about complementary consultations, but, if you're not quite sure how to make that approach to your OB or how this would work with the treatment that you're getting, a complementary consultation would be a good place to start, because that can kind of open both the dialogue between you and our pelvic floor therapists, and also help our pelvic floor therapists, help you to approach your OB or send paperwork to your OB to talk about, what's going on with you. And that way it kind of becomes a sort of group treatment of everyone on your team trying to get you where you need to go. So I mean, just kind of general questions like how old are most pelvic floor patients?
It really varies. I mean, on the younger end, we've seen athletes who just, that's one area that they don't strengthen. And so it may be that it could be pain, or it could even be the leaking during athletic competition. It could be people who, college age students who have found, going in for that very first pelvic exam and find that it's painful. Or then, like I said, that kind of pre and postnatal. But then we also have older patients that could be more of an age-related incontinence that, they're not using muscles in their hips and legs as often as they had been when they're 5-10 years younger, that has caused muscles even in their legs and hips to become weak as well, that can lead to pelvic floor weakness.
Yeah, it's strange to like be sitting here and I'm having just like realization after realization of all of these things, that were just part of me, like growing up. Like I ran on the cross country team, and I remember that like there, like half the team would just leak during like meets, and we would talk about it, and it was normal. We were like, oh yeah, it's what happens when you run. And like realizing now as an adult, like that's not what happens when you run. Like,
Right.
It's not necessary. We didn't have to do that. Sorry, I'm just sitting here and having epiphanies in front of all of you guys. So we're very, casual and easy to know over here at TherapyWorks. So I know that's something that a lot of people are kind of worried about, or, have a lot of attention on with pelvic floor, therapy, is like, are the appointments invasive?
No, not at all. Part of it is, it depends on what we're treating. If it is somebody who has more pain than they do the leaking, that we're trying to teach the relaxation and allowing them to, like I said, either be able to have intercourse without pain or pelvic exams without pain. There is a more invasive approach that we can take with our female patients. But it's definitely not something that we are going to dive into day one. Our main thing here at TherapyWorks is we want to build a good rapport with our patients. And so we want to make sure that our patients trust us before we get to more of those invasive approaches.
But day one's not internal usually.
Right, exactly.
And of course there are exceptions to every rule, but
exactly.
It's never. But
yeah, and there are some patients who come in knowing that is what they're here for, and they are much more comfortable with jumping into more of that invasive internal approach, day 2, day 3 of being here. And then there's other patients that it may be closer to, visit 4, 5, 6 before we go that route in treatment.
Yeah. So could you just talk a little bit about like what consent looks like in that case?
Yeah, for sure. So consent is something that we're going to check with a patient every single visit, and realistically even multiple times throughout a visit. Anybody who's been here for any physical therapy knows that we typically start with a little bit of that massage at the very beginning, just to kind of see what muscles are tight. And every therapist, even, working low back, hip, knee, shoulder, we're going to say, this is what our intention is. Are you comfortable with that? And it's going to be the exact same thing for pelvic floor. A lot of what we're working is the hip flexor muscles and the muscles on the inner thighs. And it's going to be a lot of that, here's where I'm going to be palpating. Are you okay with that? And it's a simple, no, I'm not. And we're done. We move on to whatever the patient's comfortable with. It could be they get there, we check with them. Hey, we've been doing internal the last 4 visits, but it's still going to be hey, I was thinking this is where we would start today. Are you comfortable with that? And just letting the patient know, if at any point becomes uncomfortable, becomes too much, just say the word we stop immediately and we move on to a different exercise, different stretch, whatever makes the patient comfortable.
Right. And of course, you are suggesting those things because those are what you as a practitioner believe will help the patient most. But at the end of the day, it's up to the patient to sort of weigh the discomfort of the experience that they're, having that brought them in versus their discomfort in the moment or their, not wanting you to take that approach. Right. So they will see different results, of course, if they withdraw consent, but that is always an option, whether it's invasive or not,
For sure.
Very big on consent over here. So I guess that kind of leads into the next question is, what exactly does a pelvic floor session look like, or what might it look like? I guess there are a lot of different, each appointment will be different, but what can you kind of expect walking into it?
Yeah, so the typical kind of routine of a pelvic floor therapy session, once you've gotten past that initial eval, they're all going to look very similar. There's just going to be, depending on what the patient is experiencing, we're going to tweak some things here and there to make sure it's really fitting to what each individual patient needs. But, it'll be a lot of kind of, like I said, that hands-on approach with starting with the external trigger points. Like I said, the hip flexors, the inner thighs, working on those adductor muscles, doing the outer thighs, working on IT bands, could be through the glutes as well. Once we get past that, if a patient is needing more of that internal approach, then we would at that point switch over to that, obviously behind a closed door room or in a closed door room. Once we would get through that, then we would,
you're not in the big room with all the knee patients,
right,
or hand patients who don't need the privacy so much.
Right. And then from there, we'd go through our typical stretches into exercises and what you would see or expect from a normal physical therapy visit, whether you were there for hip or knee or low back, doing any of those stretches and exercises to allow for relaxation and strengthening of the muscles.
Awesome. So, I guess the more we talk about it, the more I kind of wonder, why is pelvic therapy so unusual? It sounds like something that a lot of people could benefit from, but why do so few places offer it?
So a lot of it is, there is a little bit more of in-depth training that it's not necessarily required, but a lot of, your urogynecologists and OB doctors like seeing clinics that have more of that higher training on it, but it's just not something that's talked about much in school. Even I know when I went through the PTA program, we spent maybe 15-20 minutes. And it was just a quick, this is what it is. This is a couple things that you can do. Okay, we're moving on. It's just never been something that programs, whether it's PT or PTA, have touched a lot on until more recently.
Yeah, I know that, just being around the TherapyWorks for a while, I know that PTs, PTAs, no matter who the therapist is, they almost never have experience with pelvic floor when they first arrive here at TherapyWorks. But, being one of the only pelvic floor therapy providers in Lawrence, that's something that we fix pretty quickly. And, we do multiple days, longer than that, lots and lots of internal training to make sure. Oh, did I lose you, Brittany? Sorry, just a second. It looks like Brittany's lost her connection there. Sorry, hold on just 1 minute and we'll see if she'll rejoin. It looks like her computer died. She just texted me. Anyway, we will continue this at another time because there's still lots of great information for her to share, but hopefully this helps all of you get a better understanding of pelvic floor therapy. And if you're sitting out there today and so far you've thought, you know, hey, this, oh, she's back in, never mind, she's here. Hey, Brittany, welcome back.
Sorry about that. My computer just died.
No worries at all. So yeah, so I think we were talking about, you know, sort of the training that goes into it, and, you know, you get a little bit in school, but really we do most of it once, you know, once therapists arrive to us. And then you actually chose to continue on that training with an additional, like with an external course through, it's called Herman and Wallace, right? They're a pelvic floor rehab specialist clinic that basically trains practitioners, and they have boatloads of courses for anyone from physical therapists and PTAs to midwives and physicians, and really anything you could think of. So so you just did that training last month, correct?
Yeah, about 2 weeks ago or so.
Yeah. So so what were some of your like main takeaways?
Yeah, so just the amount of information that they shared with us in general, like I said, when I was in school, it was maybe a 15-20 minute conversation in the middle of a lecture, and then we moved right on to the next topic. So being able to take 2 days and just get so much information, and the course I took is one small piece of what they offer. The pelvic floor in general, I think there's 3 or 4, I think 4 different classes within just the main pelvic floor course. So I've only taken one of the 4, but then from there, they allow you to almost kind of specialize within pelvic floor. So whether it be more of the, patients who have had colon cancer, or, men who've had prostate cancer, or, more of that postnatal, I think there's 3 or 4 different courses that are specific to postnatal women. And I know there's someone athlete or specifically for athletes. And so there's still so much more knowledge out there, but even just the small, I say small, but like I said, it was 2 full days worth of classes. But also learning how much it's tied into other diagnoses. The pelvic floor itself is a set of so many muscles, but the muscles in your hip all connect to the pelvic floor, and the muscles in your back all connect to the pelvic floor, and all of your abdominal muscles attached to the pelvic floor. And you could have somebody who comes in, they're just a back patient, they're low back pain or sciatic pain, and through more talking to them, we typically find that, oh yeah, I do occasionally have leaks throughout the day, or I do occasionally have to feel like I'm rushing to the bathroom. Or even on the flip side, we've had patients that are there for pelvic floor, but through their exercises, they're like, man, my back has been hurting for 6 months, and now we fixed the pelvic floor issue and we fixed the low back pain all at the same time.
Yeah, absolutely. Thanks. I mean, that's so cool. And you're right, there's so much to know, which is why, people get to TherapyWorks and it's like a crash course of, and, our therapists don't even treat pelvic floor until they've been with us for a little while, because, first they learn the ropes and, how we do things here. But like pelvic floor is a whole separate topic that we have to train on before they can, treat it. And it takes a while. There's a lot to know, which is part of why a lot of other places don't do it. But we do, and we're very successful at it. We have a lot of patients that have, I mean, I see the like success stories a lot of patients write after their treatment, and it's just like, it's incredible to see the difference that you guys are able to make.
Yeah.
And like you said, like some of them are like, even beyond the issue that they came in for, they're just finding that their whole life and body is improved by, working on one thing, and it spreads. It's really cool how connected all of it is.
Yes.
So, I guess this kind of, lots of people, pee a little with things like laughter or sneezing. And like we've talked about a lot, people tend to think that it's kind of normal. So how do you know when it's time to seek help, like, or to talk to, a physical therapist about it?
Yeah. So, I mean, in all honesty, if you're wondering if it's time to talk to either your doctor about physical therapy or talk to a physical therapist, it probably is. Kind of like we talked about earlier, especially as females, we grow up hearing, once you have kids, you're going to leak a little when you cough or sneeze or laugh or jumping on the trampoline or anything like that. And, like I said, we found that it doesn't have to be the case. So if you're wondering if it's time to talk to somebody, then it's time to talk to somebody. Let us help you.
Awesome. So what is, I guess just one thing that you wish more people knew about pelvic floor therapy?
One thing is just don't be afraid to talk to your doctor about a referral to physical therapy. Just because they haven't mentioned it doesn't mean that you're not a candidate for it. It could just be that it's something your doctor hadn't even thought about yet, hadn't considered it as an option. So just be, having that open door to be able to seek help, regardless of what the situation is.
Yeah. And, and I think that it is also important to say that doctors also grew up hearing that this is a normal thing to live with. And, I'm not like sitting here blaming doctors, like we all are in the same boat. So it might not be the first thing that they think of, because you might say, oh, I am leaking quite a bit. And they're like, well, you had a kid last year. And it's like, well, that's the reason, but that's not necessarily an excuse,
Right.
And they're not living your life. They don't know that you have to pack a change of underwear. They don't know that you're worried about whether or not other people can like smell or tell, or you're not thinking about the colors of, they're not like the ones that have to think about the colors of clothing that they wear to make sure that like nobody knows, like, or to make sure that they know where the bathroom is when they walk in, or to
Yes.
want to sit in a restaurant close to the bathroom. Like, these are not things that like, it's not their life, So it's, in a lot of cases, it's kind of up to you to, take the reins of your own health and say, I'm tired of this being the case. Let's do something about it. Let's
Right.
stop.
Oh, and I think the other side, kind of flip side of that, of, just being comfortable having that conversation with your doctor and being able to say, hey, I'm, having leaks throughout the day, depending on what I'm doing. Or, like I said, pelvic exams are painful, and just having that open conversation with the doctor. And, one of the big things that they talked about in that course was, it's not an uncommon thing. 1 in 4 women typically deal with incontinence at one point in their life or another. And 1 in 4 women deal with some sort of pelvic pain. And so if you are somebody who struggles with either of those, you're not alone. Don't hesitate to reach out to a doctor about it.
Yeah. So, on the topic of, you've identified that it's a problem, you've decided to reach out. So, I imagine that, this isn't really a topic that most people know a lot about. So I imagine that a lot of people here might still have questions as we're drawing to the end of our talk, or they might kind of be sitting there thinking, okay, I'm ready. I really don't like, having to worry about this. I just wish this was something that I didn't have to worry about, So what should they do next?
Yeah, so I definitely getting a hold of us and scheduling a complimentary consultation, or even just give us a call and, ask to speak with one of us about pelvic floor physical therapy in general, get some of those questions answered. And it's one of those, if you are in a situation where you aren't comfortable with talking to your doctor about what's going on, give us a call. We can do those complimentary consultations and kind of be that middleman for you to get your doctor on board with kind of the physical therapy. Because what we do is you either come in, or we can do it over the phone. It's 10-15 minutes just kind of chatting about what's going on, what we're hoping to resolve, and then we send that off to your doctor. Your doctor signs it and sends it back to us, and we can get you automatically scheduled for an eval. So if it's somebody who doesn't want to have that conversation because they feel awkward talking about it to a doctor, or don't feel like their doctor's one who's going to listen to them for some reason,
Lawrence isn't a big town. Maybe your doctor is your friend and it's uncomfortable to just like I've been in that situation where I know my doctor and sometimes they come to my house for dinner and this is a weird conversation to have.
Right. Or maybe
someone that I sometimes eat with,
Right. Or maybe even like a college student or something, that your doctor is in a different town and you can't get to your doctor. Or your
doctor is booked up for a long time and you can't get on their schedule, but you're really ready to be done with this.
So we can send this complimentary consultation off to them and get that referral from them and get that prescription for you, so we can get you started on PT without you having to even go into the doctor and have that conversation.
Right. Just to clarify, the reason that we do that is for insurance purposes. A lot of almost most insurances require that you have a physician's referral to receive physical therapy and have it, covered by your insurance. Just so that's, clear what we're doing there. Absolutely. So, and in most cases, we can, for some insurances, we can get you right in if you're ready, and, we can schedule an evaluation. Others, we do need to get that referral. And in all cases, if you, give us the okay, we always stay in communication with your primary physician, so that you really have a medical team on your side that knows what's going on, that can all, be overseeing your treatment and, make sure that you're moving forward in all aspects and have a very global, you-focused picture of it. Occasionally, physical therapy is, every now and then when people come in for a complimentary consultation, physical therapy is not quite the right path. Like, maybe you're a man who's having some incontinence and we're concerned that it might be like a prostate issue, which, is something that we can help with on some ends, but like maybe we really need you to get that checked out, or by, someone that has imaging, or, sometimes there's a little bit of something there that, that is not really a physical therapy issue. But even in those cases, TherapyWorks has been operating in Lawrence for 28 years now, I think 28. So, we really have the connections, we know the resources, we can help connect you to where you need to go next. So no matter what, if you're wondering, if you don't know what to do about it, if you're, not sure if this is the right place to be, start here and we can either take you in or send you off. But either way, you'll know that you're moving towards getting it handled and fixing it, because you don't have to live this way. You don't have to be worried. So before we go, is there anything else you'd like to add, Brittany?
I don't think so. I think that just about covers it.
Awesome. Well, thank you so much for joining us today. And like I said, you can just give us a call at 785-749-1300 to get in for a complimentary consultation. And we hope to hear from you. Thanks so much, everybody.